Do you know what disorder affects 1 out of 110 children each year? The answer is autism. Autism is more common than AIDS, diabetes, and pediatric cancers combined. Hi, my name is Christina Hansen, and today I'm going to talk to you about autism, which is the fastest growing developmental disability in the United States. Over 1.5 million individuals have been diagnosed with autism, and the diagnosis rate keeps rising to 17% each year. Males are 4 times more likely than females to be diagnosed, and the current estimates are that in the United States alone, 1 out of 70 boys has been diagnosed with autism. Today, I'm going to help to give you a better understanding of the signs of autism, what it is, the causes and treatments, and how this disorder can be prevented. Autism is a complex neurological disorder which affects individuals in areas of social interaction and communication. It is estimated to occur in 1 in 100 births, and it is a spectrum disorder, which means that the symptoms can occur in any combination from very severe to moderate. The characteristics of autism may or may not be apparent in infancy, which is 18 to 24 months, but definitely become obvious in early childhood, which is 24 months to 6 years of age. Unfortunately, autism is a lifelong disability. Autism affects individuals in every country and region and knows no racial, ethnic, nor economic boundaries. Now, there's no one known cause of autism, but studies show that heritability contributes to about 90% of the risk. Also, children that have been exposed to environmental toxins such as mercury have had a higher risk of developing autism. Also, certain diets and receiving certain vaccines have been shown to higher the risk of developing autism. Now, the strangest thing about autism is that the affected show completely normal physical development, but unfortunately it does affect individuals significantly in social communication and behavioral challenges. The signs of autism are first recognized by the parents since they spend the most time with children. Signs include avoiding eye contact and touch, repetitive motions and behaviors such as rocking and twirling, repeating words and phrases, schedule change issues, inability to express basic needs, very little smiling, self-abusive, and an overall hard time interacting with others. Now, though there is no one known cure for autism, autism is treatable. Children do not outgrow autism, but studies show that early diagnosis and intervention can lead to significantly improved outcomes. One treatment that has been shown to improve children that have been diagnosed with autism is biological treatments, which include medications such as Ritalin and Adderall, diets that consist of removing gluten, and behavioral and education mediation, which include areas of social and language skills. Another treatment is sensory therapies, which include occupational, sensory integration, and auditory integration treatments. Also, treatments by communication, which include picture exchange communication systems, also known as text, sign language, facilitated communication, visual strategies such as using pictures for communications. Now, none of these methods completely wear the children of the symptoms, but they do help the child improve the quality of life extensively. There are so many different theories on how to prevent your child from developing autism. Some of them are to refuse certain vaccines or to have your child at an earlier age. Now, the only way to figure out how to cure and rid the population of autism is to do the research, but unfortunately, that is currently hindered by funding. According to Autism Speaks, autism research is one of the lowest funding projects, but it affects the most people. According to the chart that I have here, I have a chart of 5 different diseases that affect children and the number of children it affects and the funding it receives each year. The diseases are leukemia, kidney disease, cystic fibrosis, juvenile diabetes, and then autism. For the disease of leukemia, it affects 1 in 25,000 children and it receives $300 million in funding. Kidney disease affects 1 in 20,000 children and it receives $160 million in funding each year. Cystic fibrosis affects 1 in 5,000 children and it receives $75 million in funding. Juvenile diabetes affects 1 in 500 children and it receives $140 million each year. And then autism, which affects the most children, which is 1 in 150 children, only receives $15 million in funding each year. I feel it should be an issue that everyone finds important since the numbers are growing so quickly as the years progress. If the increase of autism continues, pretty soon everyone will know somebody who has autism. With this knowledge comes great responsibility. Therefore, we should share this information with others in order to help the cause. We need to recognize the signs in our children and have them diagnosed and treated immediately. We need to try and prevent autism as much as possible in order to keep this disease from growing. Thank you.